Today I want to talk to you a little bit about allergies in our dogs and cats. So allergies are something that can be extremely frustrating. It's something that, some pets respond to just getting medication, some pets respond to being on special diets, some pets have to have a combination of both, some pets need a medicated shampoo. There are so many things that we can do to help manage our allergic pets. And so I want to start with what happens when a pet has allergies, whether it's dietary or environmental. What is physically happening in the body? And so if you were to take a biopsy of a quote unquote healthy dog, a normal dog that doesn't have allergies, their skin looks like a brick wall. They have bricks and they have mortar. So our dogs and cats that have allergies, their brick wall is a bit thinner and they don't have the mortar that they need to fully protect themselves. And so they have the bricks, the big part of the wall, but they still have these little cracks and crevices that aren't there in a quote unquote healthy dog. And so what happens is these dogs are more prone to bacterial and yeast infections on their skin because of these little cracks and crevices. So then not only are you itchy because of your allergy itself, but you get these secondary infections, and that also makes you itchy. If you aren't addressing both of these things, your pet is never going to be comfortable. We have to address the allergy and the infection. So a lot of times what I'll see is a pet that's been maintained beautifully on their diet or their medication for their allergy, all of a sudden will just be itchy. And usually it's because they've gotten a secondary skin infection. We call that a flare-up. And so now we'll have to rein that infection back in and they go back to being hunky-dory, not itchy at all. Another thing that we have to consider in some pets that are very prone to allergies is once they're exposed to that skin bacteria and yeast, they can actually become allergic to those infectious agents. And that's a real downward spiral, if you can imagine, because you have your allergy and that predisposes you to your infection. And now your infection has caused a new allergy. And so we're just gonna keep going on this little hamster wheel around and around and around. And so those are the pets that I highly recommend using a medicated shampoo regularly just to minimize the surface bacteria and fungal infections on their skin, to make sure that we're minimizing that second level of reactivity and keeping all those things to a minimum. So how do we determine what our pets are allergic to? So the gold standard is to refer patients to a dermatologist, and that is something that is easily done for many people because they live in larger cities, and dermatologists are readily available. And those dermatologists will do something called intradermal allergy testing, where they do all these tiny little pokes. I'm sure you've seen this on people as well. And then they measure how much of a reaction they got at each of those little injection sites. And so based on that, you can see what animals are allergic to. And you can choose to do immunotherapy or just regular medical therapy and see how your pet responds. That's not always available for people that are in more rural areas like myself. A lot of our clients either cannot afford to go to a dermatologist or don't want to travel that distance. And so we do a lot of blood allergy testing. And I know dermatologists will poo-poo that until they're blue in the face, and I get it, but I've seen it work and help a lot of patients. And so I think completely writing it off as an invalid test is inappropriate. I think that we should do what we can to help the patients that are in front of us and meet those clients where they're at, both financially and geographically. And there aren't any dermatologists popping up in Southeast Missouri. So like I said, we do what we can. And those allergy tests will also look at the blood of the animal and see what they are more likely to react to, both environmental and dietary. And so then we can look at their allergy list and see what food we need to keep them on. A lot of times we'll do a hydrolyzed food. If you don't know what a hydrolyzed food is, it's a food where the protein in the food, whether it's chicken or a soybean or whatever, has been broken down so that it's so small, the particles, that when they're absorbed by the gut, the body does not see them as inflammatory or reactive. And so those are considered the top tier of hypoallergenic foods. And so those are foods like ZD, HA and hydrolyzed. There's also one called ultimino, which is a hydrolyzed feather protein. That's considered like the ultimate. I have yet to have to put a pet on ultimino, thankfully, because it's very expensive, but I do have many clients on the other hydrolyzed foods, and their pets do quite well. If the pet has more environmental allergies and less food allergies, then we may talk about doing something like Apoquel, Cytopoint. We may talk about a more natural approach with acupuncture and herbal medication. It just really depends on that pet's presentation and their severity. We can also use a medication called Atopica. That's something that I haven't used a lot in dogs because Apoquel really came on the market and just like destroyed everybody, which is great. I mean, it works beautifully in most patients. I have very few pets that have not responded to Apoquel, but there is not a great option for our feline friends. And so Atopica is still a great management tool for environmental allergies in cats. So, then you have the overachievers of the group that want to have both an environmental and a dietary allergy. And so those are the ones that are really tricky because we have to put them on the food and then keep them on their medication. And, usually I'll try to taper them down a bit to see, if we can work away from the medications at different times a year or different seasons while they're still maintained on their special diet. I hope that this has been a helpful video and that you've learned a little bit about allergies in pets and how to manage those conditions.